In this class, we learn about general anatomy of cardiovascular system. So the competency is blood vascular and lymphatic system. Blood vascular system. The primary organ of blood vascular system are heart and blood vessels. Using the blood as carrier, the cardiovascular system delivers oxygen, nutrients and hormones to the cells in the tissue. On its way back, picks up waste product, carbon dioxide, from the cells to exchange it for oxygen in the lungs. White blood cells in the blood protect the body from bacteria, virus and tumor cells. Heart propels blood out of the chambers into blood vessels to be transported to all the body tissues. Lymphatic system. Lymphatic system complements the work of cardiovascular system. Lymphatic system has the lymphatic vessels, lymph, lymphocytes and lymphoid organs. Leaked fluid from tissues from the cardiovascular system is returned to the bloodstream by lymphatic system. The lymph nodes and the lymphoid organs help cleanse the blood and house lymphocytes involved in the immunity. The competency is pulmonary and systemic circulation. Pulmonary circulation. The heart is a double pump. The circuit from the right ventricle to the lungs and back to left atrium is called pulmonary circulation. Its function is to carry blood to the lungs for gaseous exchange and return it to the heart. Systemic circulation. The circuit from left ventricle through the body tissues and back to the right atrium is called as systemic circulation. Because the left ventricle pumps blood over long distances in the body, its walls are much stronger compared to the right side. Another competence is general differences between arteries and veins. In the picture you can see the arteries and veins. Arteries carry blood from heart to the capillaries. They control blood flow and blood pressure. Arteries and veins are composed of three layers, that is tunica intima, media and adventitia. Arteries contain more smooth muscle and elastic connective tissue. Veins. Veins return blood from capillaries to the heart. They serve as storage areas of blood. They are also thinner and have larger lumen than the arteries. Large veins have valves, venous valves. Functional difference between elastic, muscular and arterioles. Arteries are the blood vessels that carry blood away from the heart. The passage of blood in the arteries begins in elastic arteries, passes through the muscular arteries and ends in the arterioles. Elastic arteries are large arteries located near the heart. They range from 2.5 centimeters to 1 centimeter in diameter. Because of their large size, lumen, they act as low resistant conduit for blood to medium sized arteries. They are called as conducting arteries. In elastic arteries, the tunica media has more amounts of elastic fibers. The elastic fibers in the arteries dampen the surges of blood pressure. The elastic arteries the elastic fibers in the arteries expand in response to increased blood pressure, and the potential energy is stored in the walls of artery. When the heart relaxes, the elastic arteries recoil, propelling the blood forward. Muscular artery. They are also called as distribution arteries, and they supply blood to the organs of the body. These medium-sized or middle-sized arteries are the named arteries in our body. Their size ranges from 1 centimeters to 0.3 millimeters. Their tunica media is thicker than the adventitia. The muscular artery controls blood flow through them by contraction of the artery, depending on the needs of the organ. The elastic lamina present in the muscular arteries dampen the remaining force of the pulsatile pressure produced by the heart. Arterioles. Arterioles are the smallest arteries. Their size ranges from 0.3 millimeters to 10 microns. Arterioles lead to the capillaries. Diameter of the capillaries is controlled by local factors which regulate the blood flow. Usually, the generalized sympathetic system regulates systemic blood pressure. For example, sympathetic vasoconstriction raises blood pressure in response to fight and flight situations. Then the competency is portal system and its examples. In a portal system, blood flows through two consecutive capillary networks. Portal system are present in kidney, between hypothalamus and anterior pituitary gland, and between intestine and liver. Hepatic portal system, it receives blood from digestive tract, pancreas, gallbladder and spleen. Intestinal blood is laden with nutrients, proteins and sugars, and the portal system gives liver the first claim on these nutrients before blood reaches heart. Hypophyseal portal system. It consists of network of primary capillaries in the hypothalamus. These small veins run down the pituitary stalk to reach the anterior lobe of pituitary gland and join network of secondary capillaries in the anterior pituitary gland. Hypothalamus controls the anterior pituitary gland by releasing hormones that enter the capillaries in the hypothalamus, which in turn reach anterior pituitary gland. The concept of anastomosis and collateral circulation and the significance of end arteries. Anastomosis. An anastomosis is point of convergence between two blood vessels other than capillaries. In artery and vein anastomosis, called the shunt, the blood flows directly from artery into the vein and bypasses the capillaries. Shunt is present in fingers, palms, soles, toes and ears. They reduce heat loss in cold weather by making the warm blood bypass exposed areas. This makes these areas skin vulnerable to frostbite. The most common anastomosis belong to the venous system. In this, one vein will empty into another. This mechanism provides alternative venous drainage. In the arterial anastomosis, two arteries merge to provide collateral circulation. Examples are coronary arteries and anastomosis around the joints. The point where arteries come together is called as anastomosis. It provides alternative route of blood supply called as collateral circulation. Collateral circulation is common around elbow and knee joint, as there is temporary obstruction to blood flow during limb movement. Significance of the end arteries. Arteries which do not anastomosis are called as end arteries. Examples of end arteries are the central artery of retina, labyrinthine artery of the internal ear, central branches of cerebral arteries. Occlusion of central arteries, end arteries, result in serious outcomes. Example, occlusion of central artery of retina results in blindness. Then thrombosis, infarction and aneurysm. Failure of blood to clot takes few lives than unwanted clotting. Thrombosis is unwanted clotting of blood in an unbroken blood vessel. Clotting is an old age problem. Blood clots are common in the veins because of sluggish blood flow. Thrombosis is unwanted clotting of blood in an unbroken vessel. Thrombosis grows large enough to block a small blood vessel, or a piece from it can break loose, travel down the circulation as an embolus. Embolus can lodge in a small artery and block the blood at that point. If the blood vessel blocked belongs to heart, brain, lung, kidney, infarction occurs. Infarction is tissue death. Aneurysm. An aneurysm is a weak point in the wall of an artery. Aneurysm is a condition with thin-walled bulging sac in an artery or heart. It pulsates with each heartbeat and may rupture, leading to hemorrhage. Dissecting aneurysm. In dissecting aneurysm, blood collects between the tunics of an artery and separates the layers of arterial wall, usually because of degeneration of the tunica media. The most common sites of aneurysm are abdominal aorta, renal arteries and circle of Willis. Aneurysm can compress surrounding tissues and organs and cause pain, discomfort and death. The most common cause of being the atherosclerosis and hypertension. In the picture you can see dissecting aneurysm. Thank you.